Our final presentation of the day is entitled Uberization of Healthcare. Just to note, this session is off the record and will be presented by Shaun Braun. Shaun is Group Information Officer at MedSurg Neurotech at Stryker.
All right, so I have the closer. You got the pre-lunch, post-lunch, and I'm pre-cocktail. So I'm not sure. Those are the tough slots. I was trying to get cocktails in here during this, but they kind of blocked that. So Uberization of healthcare, it sounded like there was some pretty good dialogue surrounding this topic even earlier. Uberization is probably one of those words that's been thrown around for every industry. I thought, I came up with something original here. So Uberization of healthcare, and then I Googled it, and there were about 25 articles, including one in Fortune. So it's a topic that's out there. And the way I want to walk through this is, are we ready? Are we ready as a society? Are we ready as IT leaders? And I think while I'm going to zoom in a bit on healthcare, this concept of Uberization and what that means for us, it doesn't matter what industry you're in. It goes a lot back to the speed question earlier. And then how can we be stewards of this Uberization process as we move through? So within healthcare, you've got Internet of Things, you've got analytics, mobile, predictive analytics, big data, all the Hadoop data lakes, all that swirling. We're all staring at that and figuring out what does that mean for our industry. What's unique a bit about healthcare is it's been a very stagnant industry, and it means a lot to societies around the world, and governments are going broke because of it. There's a lot of political strife around healthcare and access to healthcare. So these two trends have really started to come together very quickly. And even in Silicon Valley here, you could see that a lot of tech companies that were pointed at other industries have very quickly zeroed in on healthcare, one for the opportunity, I think the other just for the impact it could have. So Uberization, it's funny, the word's out there a lot, but I had a really hard time finding a definition for it. And so this is one I found by David Glantz, who I don't know who he is, but I'll give him the credit here. And we'll come back to this, because I think the interesting part is, and I'll rip through this, the concept of Uberization takes on the general meaning of disrupting any industry through the use of technology to circumvent, this is the key part, unnecessary bureaucracy and legislation. So Uberization and healthcare, bureaucracy, legislation, you'll probably see where some of these things may collide. So what I'll do is I'll do a little walk just around what how the Uber trends kind of changed, transportation, and then I'm going to flip that towards healthcare, and then hopefully it'll spur a little bit of dialogue. I love Q&A, so interrupt me, or if you've got some at the end, I'd love to take those. So this was maybe not in California. We don't see this very much with the umbrella, maybe this big El Nino phenomenon. But this is how it was before. You didn't know what corner of the road to stand on. You didn't know what pose to strike to kind of hail a cab. And it was pretty frustrating. And now, what do? You have a totally different user experience. This came on rapid fire. So you've got the watch. I can tell you exactly en route, it'll buzz you. You can walk out and meet your Uber. You got your own kind of private black car driver. And then the best part, I think, is you don't have to exchange any money. There is money being exchanged, obviously, but you don't physically have to exchange any money. And you jump in, you jump out, you're on your way. You don't have to worry about tips or anything else. It's just done. It's easy. So I think when you think about what Uber did to this industry very quickly, and it transformed it and ripped it apart in many ways, and it's still rapidly changing. So everything's great, right? Not exactly. You can Google Uber and you'll find some pretty interesting pictures of watches and really neat user interface and transformations and $60 billion potential market cap as they come out. But then you also find a lot of pictures like this where there's taxi drivers in Europe, shutting down major streets. You have riots. You have this oddity of now there's this middleman between you and the taxi drivers. I've done this where I'll get out at Chicago O'Hare, and I'm on my Uber app, and there's a line of taxis right there. But for some reason, I feel like, no, I've got to do this because swiping a card is going to be that much more difficult. So they've created this middleman concept, it's brilliant, but it's pretty interesting how that starts to break down. Nationalism has flared up, for sure. Germany kicked Uber out, France, well on its way or already there. And then it starts to get, some violence. And even, you also have a lot of the tracking that's going on about your movements. And as you're coming in and out, who owns that data? I think that was the question before. Now it's in an app. So the middle picture here is that's from my Facebook page. That was, my wife and I are blessed with 4 kids. And we were on, no twins, by the way, so that's 4 in series. That was on our vacation. We went to France, and we traveled down through the south of France. So we landed in Charles de Gaulle, and we're driving in a big Uber vehicle. It was one of those big, Mercedes Vito vans, because that's all that can hold all of us in our gear. And it was great experience. Hit the button, it pulled up, and usually with Charles de Gaulle, you got to barter with the taxi, and you could pay €70. And then the next time when you take the exact same thing, it's like €120. And why? Well, I don't know. Don't worry about it. Just pay. Great. Jumped in, €70, really nice van. And we get into the middle of Paris, where all the kids are looking out the window, everybody's excited. And then, there was a demonstration. And for Europe, pretty normal. And so I kind of lean up to the window too, going, I wonder what it is. I don't speak French. My wife does. And so I was about to ask her what it was. And the side of the car just gets whacked with eggs, just lit up the whole side of the van. And of course the kids are like, why were they throwing eggs at us? What are the eggs for? It's like just rattle questions. That bottom picture, that was maybe 5 days later. They were flipping Uber cars over in Paris and setting them on fire. So I think we got lucky with the egg treatment. But just to make a point here is, Uberization has moved so quickly, and there are massive benefits, and where they're going to take it. I think we've probably all read the articles. It's just in its infancy. San Francisco has, I think it's called Uber Kitten or Uber Cats, where you can, I don't know, this maybe isn't that amazing, but you can hit a Uber and a car will pull up with a bunch of kittens that you can play with for a period of time. And then they'll come back and pick them up and leave. And it's backlogged now. You can't get the kittens. So I don't know what that says about society. So anyway, let me move on here. Here's kind of the drawback. So if we are draw together with healthcare. So healthcare, similar setting. You got very long queues. You've got complex billing where you're not sure who you're paying or how or what. Very poor user experience. And limited use of technology. Now it's getting better. It is getting better. So I'm not saying this phenomenon hasn't started, but it's just speeding up now. So you start to look at this, and the backdrop is there. So what I want to do is I want to walk through some of the areas where Uberization and really technology advancements is changing healthcare. And at the end, maybe we'll come back and see what can we do again as stewards. And the parallels here, I think, will touch whatever industry you're working in right now. So continuum of care, this is one area where, so where does Uberization really touch in healthcare? And this is patients before maybe they even know that they need to be a patient. This is the population. This is population health. And as you come through that, you have an event or a sickness, and that continuum of your care as you come through the system, and then all the way out to rehab, prehab, on your way to a healthy living status on the way out. So this Uberization touches all elements of this, and we'll walk through a couple of the technologies here. One just around, I think it's actually the top of the screen might be blocked off, but this is around wearables. And so with wearables, I think the real interesting part is, and I notice a lot of people have got their Apple Watch on and every other activity. So what you can do is you can do activity monitoring. So and even gait analysis and preemptive alerts. So when you have an individual that has a bad knee, but they're not quite ready for surgery yet, you can give them wearables to track their motion, and it'll even track their gait. So it shows how they're progressing. And when it gets to a certain point, you can proactively reach out and say, are you in a lot of pain? You can reach out because no one likes to be having these conversations. So again, the wearables, the sensors can start to make these connections for you, and that data that's getting gathered, you can start to preemptively reach out to individuals. The one, and I've got a good friend who's on the board of Mobiquity, and this idea of this digestible even, where you actually have a digestible that will track your medication. So that's always a big thing, whether you're doing clinical trials or otherwise. Are you taking your medication? Yes, of course I took it. I don't remember actually. And if you go multiple days, this will actually track whether you are or not, and it'll give you alerts. Whoops, you forgot to take your medication today. And for some folks, they're like, well, alert on what? On a mobile phone? Okay, I don't have a mobile phone. It alerts your friends and family, your support network. And the interesting part is, if you start to look at that, it could even start to alert other agencies as well. So some things have come out across antipsychotic drugs. And is the person taking them or not? Do we as a society want to know that and be able to preempt some of those activities? So the interesting one here is this surgeon, and a few surgeons are doing this now in orthopedics. They're actually handing out eye watches at the end of an orthopedic reconstructive surgery. So hip or knee replacement. They'll just, part of it, the exit is here, fill out some papers, and here's an Apple iWatch for you. Now, $300-400, what do they get for that? In the grand scheme of the cost of that procedure, it's not a huge amount, but still, that's not a trivial expense. What it is that surgeon is an artist. And they could do the most amazing surgery, reconstructive surgery for that knee or hip. If that patient, when they leave the hospital, there's zero control of what they're doing with their rehab. And with hip and knee surgery specifically, and shoulder and spine, there's very regimented rehab that you have to do. And if you don't, that joint will tighten up, and they'll come back and say, there was a terrible surgery and you need to fix it. Now, the cost of the healthcare system is immense. The brand of that surgeon is also at risk. So handing out a $300, $400 watch to track it, and the person gets to click their Uber button too. I mean, there's a benefit there. It's pretty interesting, and a lot more surgeons are starting to take this angle as they move forward. So this one, I always love when you find old cartoons, and it kind of goes back to the Back to the Future comment also. And when things are happening and you're staring at it, and yikes, I am old. So the Jetsons up in the front, kind of the telemedicine idea. Oh wow, we could be talking to a doctor through some flat screen. First off, there is a flat screen now. The second thing is, yes, you can talk to your doctors through it. So the access, when you start even thinking about, mobile's so prevalent in a lot of emerging markets. So the access of doctors outwards, where folks would have to travel multiple days to get to a spot where they could see a specialist, that's huge. The gamification, so if you see up here, and it could be rehab or otherwise, simple technologies like Microsoft Connect or Wii, where you've got cameras, you've got very smart cameras that are extremely accurate. The Microsoft Connect is the same camera structure that's going in the HoloLens, which again is coming out probably 2016-ish. So you can get extremely accurate readings. So you can do your rehab at home. And a lot of companies are starting to look at this, and how can you push rehab out so the patient can own it, so they don't have to call someone up and see anybody and talk to anybody and wait in line and queue up. They can actually go home, and the surgeon and the supporting hospital network can track, are you doing your rehab? Are you starting to hit those limits where, okay, you're trending, or you know what, you have not gotten off this degree of flexation for 2 weeks. You know what, you need to come in. Something's not going on. Let's check it out. And then this one, again, with 4 kids, I love this, and we just had to deal with this recently, is, after 4 kids, if there's an ear infection. You're like, oh, okay. What do you have to do? It's like a 4-hour process. Like, someone has to come off work. You have to set up someone to watch the other kids. You just need to go in. They're going to look in the ear. They're going to go, yep, you got an ear infection. Go get a prescription. But instead of taking care of it like this, you blow out 5 hours of your day. So these technologies are starting to come now, where telemedicine and that's actually a simple add-on to an iPhone, where someone at home could take a look, doctor could go, yep, push a button, prescription's out, and you save 5 hours of your day. So again, I think that the telemedicine, thanks for the banner, I need that. So I think the telemedicine side is definitely started to accelerate. Robotics, this is a pretty interesting one. I had to bury one little Stryker product in there also. The Da Vinci is the one that most folks probably know, and that's the one in the upper left, which Stryker had looked at very, very early on, and they passed, which was probably not a wise decision. That technology's really taken off. But when you start to think about robotics in surgery and the accuracy and the repeatability, and the interesting part is the adaptive learning, think about the analytics you're pulling off of that. When you have a Da Vinci robot that's redoing different, and you could get the procedure outcomes based on exactly what that robot is doing. Same thing with the Mako robot from Stryker is, you could start to really get a sense of a lot of the data that's pulling off of that, both from a service perspective and an efficacy perspective. And last, the remote. I don't know if has anybody seen any of these robots rolling around hospitals? A couple folks, yeah, it's a little scary. There's like this little robot cruising around with a doctor's head on, and they'll pull right up to your bedside and have a conversation. But it's coming, and whether it's coming inside a hospital or in your home, I think the technology is there. And what does that allow you to do? So it allows, if you have a specialist, it allows them to expand their network, which is great for their business. Instead of having hospital networks where they have to hustle around, they could sit in a control room of sorts, and it's good for us because they can touch more patients and have an influence on the patients that probably really need to talk to those high caliber surgeons and doctors and specialists. So again, pretty exciting area. I think robotics is changing healthcare very quickly. The Internet of Things, I always have to put the toothbrush up here. I think this was, Benioff mentioned this a couple Dreamforces back, which I still kind of chuckle at it. But again, it goes back to the rehab, like your dentist. You got one of these smart toothbrushes. Are you brushing your teeth or are you not? It's pretty easy to tell. Unless, with some of these, the wearables, folks were putting them on their dogs or otherwise just to track that, yeah, I am actually moving around. So I guess you could brush the teeth of your dog also, but what's the point? If you're sitting there brushing the teeth of your dog, you might as well do it yourself. And then as well, from, connected scales, and then you can, from a wellness tracker, you can really start to aggregate this data. And I think that's the key. You can aggregate your scales, your wearables, your toothbrush, so you can start to really get a personal dashboard of where are you? Where is your personal health? So I think, these areas are pretty exciting. They're all moving quickly, and it's changing healthcare. So this is my attempt at like a panacea slide. Like everything's beautiful, right? You got cloud, doctors, driving around with robots, and all this data getting sucked up. So you have these, you don't need to talk to anybody anymore, and just treatment's going to come to you. So here's the Uber flip. This is attacking quickly. It's attacking healthcare quickly. I think this Uberization is attacking all our industries quickly. So is there going to be a backlash? Is there going to be a healthcare backlash? And I think we're starting to see elements of it. And again, this gets back to the stewardship of how can we as IT leaders in our industries move forward with innovation, move forward with the technical elements that have to happen, that have to add that efficiency to each of our industries, but do it in a way where you don't have the backlash that Uber had in many cases, just to streamline it. So when you think about healthcare, there's a lot of big data exposure. This data is all collected. So who owns that data? Do you own that data? You could think you do. The patient now is in command. I think there's a couple books out there. It's like, doctor, the patient will see you. That I'm here, I own my data, I'll come see you now. So when you start to think about privacy and some of this data getting pulled out, I made that comment earlier on the panel about the unstructured social data. That's out there. You're now uploading your weight and your activity tracker. So all this data around your health is out there, and what your lifestyle is. And you got digestibles, and you got all this data. Maybe it's just going to research kit. for Apple. You got Microsoft has their health vault. So, a lot of this data is being collected now off the wearables. Now, the question is, and kind of the crux, and the question I'll flip back is, how is this going to affect? With Affordable Health Care Act, there was a great push to, as a society, we were going to pay for performance. We're not just going to pay per treatment, we're going to pay the hospitals and the surgeons on what their performance is. That was the whole concept of pay for performance. I think we're a year or two away from that flipping around, where we are going to have to pay for our performance. And whether everybody's probably had these wellness websites at their work, where initially it's, hey, I'll give you $25 if you fill out this whole website and share everything about yourself and your blood pressure and cholesterol. Do you smoke? Do you drink? It's like, no. Yeah, I'm perfect. Everything's great, right? Give me my $25. I didn't even do it for $25. I was like, I'm not going to fill it out. A year later, it was $650. I was like, okay, what's the website? And I'm filling the thing out. But I'm still, on some of those things, like, well, what's considered a drink and this and that. It's like, we live a European lifestyle, so, wine every night is no problem. But pretty soon, it could be, you wear this device, and I'm pointing at the Apple device, you wear this device, and it will track everything about you, and then you will be incented, positively and negatively, for your performance. So, is that good? It'll incent us. The cost of the healthcare system will come down. But it's a little scary. It's a little scary to think, and you can start to think about the roadblocks that'll come up as this comes online. This is going to come. I have no doubt about it. 2-3 years, this will happen. Devices will be handed out instead of websites. You wear it, and you'll be incented to wear it. And then you'll be incented on milestones throughout that year. So we won't get to have those chocolate-covered niceties. And we'll say, gosh, I haven't run for 2 weeks. Who cares? I got to pay that. That milestone's coming up. We'll be out on the road doing our exercise. So hopefully you can see some parallels about how Uberization, that the incentives inside healthcare, Uberization of technologies, they've come together. It's going to do some amazing things for us. It absolutely is. But some of the roadblocks and the backlash that we saw when we looked at what Uber has done, and as they're trying to track that very aggressively with great speed across the world, we are staring at those same activities inside healthcare and this Uberization of healthcare. So as stewards of these journeys in whatever industry, I think that's the big question that I just wanted to pose. And what steps can you take to accelerate innovation, to move forward where these technologies are going to do amazing things, but do it in a way where we don't run into some of these aspects where the backlash will come, because the biggest thing that stops innovation is people. It's not technology. It's change management. It's silos. It's people. So how can we make sure we're bridging or silo busting, however you want to look at it? And last point, just, you connect the dots. You always have to look backwards to connect dots. And you think about Uber, and in the Bay Area, I'm sure folks have seen this, the little, Google's car. And, at some point, the taxi drivers are rioting now. There's not going to be any drivers in those Uber cars very soon. Those are going to be fully autonomous vehicles. So taxi drivers, the Uber guys are like, yeah, we're over here. And pretty soon they're like, wait, what's that? We're not even driving anymore. And so in healthcare, we got robots. How many nurses do you need? If you guys have seen that movie Prometheus, do you ever even is there a point where we won't need surgeons? Or a surgeon could watch 10 pods. So it's amazing what's going on with technology. It's just, we have to keep our eyes up to watch for the aspects that will slow it down and have the negative impacts as we move forward. And that is all I had. So I'd love to field any questions, unless everybody's working. We're not sucking data off your devices right now, and Stryker doesn't have any incentives yet or anything. Yes, please.
Are there any particular healthcare providers, healthcare systems that you see are more on the front edge of adopting this?
Yeah, there's Cleveland Clinic for sure. They've got some great videos out there also. Mm-hmm. they definitely are pushing the technology front, both honestly from a logistics perspective and treating the hospitals as supply chains, but as well as really empowering a lot of wearables on patients as well. So Cleveland's one for sure. I would say UPMC, also Stanford. I'm a Cal guy, so yeah.
Okay. Any other HMOs or anything in particular you see?
It's interesting. The part that I think is going to come quickest is the wearables, the incented wearables. So you'll see, the HMOs, first there were partner groups that a lot of companies would come in and add, and they were true. They're wellness. That really is, you want to keep your healthy population and engaged population is great for your workforce and your utilization. So it's not that this is all, there's some negative connotation to all of this, but the HMOs are starting to see what a lot of these startups in the area have done, and so they're embedding those inside some of their services and their interactions. So they're going direct with a lot of these wellness sites and wellness incentives. So I do see a lot of that as well. Yeah.
Okay. I'm a Kaiser member, so they keep trying to push, their whole campaign around Thrive. Obviously, if they keep me healthier, then I'm less costly to them.
Exactly. Yeah, and that's actually a great, so I'd be curious because I was talking to a couple of those folks out in DC. There was a clinical, there was an eHealth clinical.
Yeah.
And so what does Thrive today look like, and what do you think where do you see it going?
It's mostly advice. They haven't got to the point that they're providing any kind of a device that's measuring, your health. They're very good on electronic records. Amazing, driving that, at least of the Bay Area healthcare providers. But I haven't seen take it to this next stage that you were describing. Maybe someday.
Yeah. A couple years, I think.
A couple of comments.
Sure.
As an IT attorney in the healthcare world.
Oh, there we go. Okay.
So just a couple of observations. The challenge.
Did you say as an IT healthcare attorney? Is that what
correct.
You said? Okay. All right. I'll ground on that. Okay.
The challenge we have, and you made reference to it, is the Uberization, which meant reference to unnecessary regulations. My clients who are big healthcare systems would certainly argue unnecessary regulations. Of course, our customers / patients would say very necessary. So it all depends whose interests. But in terms of HIPAA, which is the big privacy and security rules, it all depends who issues that wearable. If that wearable is issued by a covered entity, somebody subject to HIPAA, now it's PHI. If it's sold by Walgreens, it's not PHI. And so a lot is, going back to your watch example, if that watch was sold, it's probably not PHI. If the watch was given by the provider and for use, it's PHI, which means you could be subject to a lot of fines. So those kind of tricky things are tough to have technology roll out pretty fast.
Those sound like roadblocks to innovation, don't they?
They're roadblocks, but I think patients are concerned about the security of IoTs. And wearables are just another IoT that have not necessarily got good security yet, from our experience.
Yeah.
The other thing is as to ownership and use of data. Generally, you can avoid some security issues if you go towards use license as opposed to ownership. Very different in terms of who's liable again under HIPAA. So, but it's tough to get around, I suggest, regulations that balance the risk exposure between two private parties, which is what HIPAA does, between the patient and the hospital, versus what Uber did, which was the city versus a regulated entity. And that was just, hey, ignore the cities. But you can't ignore, it's tough to ignore another private party that you're interacting with. Thank you.
Yeah, no, I absolutely agree with you. I'm only prodding a little bit because we do need a controlled motion through here, and but it is you were kind of holding up the shield, and you will stop here, and it's how we navigate through those, and I totally agree with your point. Is we'll have to have that balance. You can't just circumvent and go around, but a lot of patients and even some technology companies are collecting e-records And they are saying, here, this is for you, so you own it, so we don't have anything to do with it. Now the patient has it, and you can start to wrap big data analytics around it, population health, who else has these sort of, it's just an and some folks will be very comfortable with that. Others will say, absolutely not. And so how do we serve both populations, the ones that are ready to go, and then, I would say the larger majority, which want the protections and pacing.
So I have a few comments here. Is wearables, as you said, is a big area now. Wearables with this is you own the data. I own the data. I have a couple of wearables. One, blood pressure at home. I check every day, and all my history is right here. It's not going anywhere.
Who else owns it?
So not yet, but when I visit my doctor, I'll show it to my doctor. Yep. Right here, it says, see my blood pressure last 3 months. You can see it here. I'm not giving you, but you can see it here. So then that's how I think the wearables, a lot of startups are trying to go after that market with the wearables with your device. And that's one big area. And the other comment I want to make is you said, oh, you wear my wearable and I will give incentivize with these things. I think it's not that far away because we already see that in auto insurance.
Yeah, exactly.
Put a plug into a car, your insurance rates are 25% off. So pretty soon we'll see if you carry this wearable, your health insurance is going to go down.
Yeah,
so
and there's even, and I'd heard, although I don't have one of these on my car because I would not get the positive incentives, that there's accelerometers, that
Yep.
kind of show your top speed and how aggressive you're driving. But I love the analogy. It's exactly
and then some of the newer insurance companies are saying, you don't even need a gadget. Just start my app when you are driving, and then I'll monitor you, how you're driving.
That's a great, because Waze is collecting that data now. They just, whether they're using it or not. It's wild.
Yeah.
Now I'm going to turn that app off in my car on the way home.
Hi. In my limited personal experience with what you might call telemedicine, as simple as just an email to and from your doctor or something, it seems as though, again, in my personal experience, it's like there's a battle going on between the insurance companies and the doctors. Your ordinary provider or doctor won't get paid unless you come in the office to see them, right? And the insurance company is willing to provide telemedicine, but it's through their doctors or through their nurses. You have any opinions about that?
Yeah, it's again, and this is, there's multiple players, and healthcare is extremely complicated. You think our IT architectural data center, you start to draw out a Visio of the interaction of the different players. In healthcare, it's madness. So they are starting to add codes now. So initially, you couldn't, a doctor, even if they responded to an email or took even a phone call or Skype, they didn't even have a code to get paid for by any insurance company. So they've changed that now. So they're starting to add some of those codes for those interactions, which is good. But you're exactly right. It's a funnel. It's an access funnel then, because those controls, they can start to steer you towards the doctor network that they want to. And obviously you can imagine the incentives inside that are built out. I don't really have I don't have a good answer for, honestly, I just think the capitalism and the cost, and everybody's going to expect that at some point. I think right now it's being used as a differentiator. There's going to be pressure. I think the expectation is going to be there for everybody to do that. And if you're not, you will have zero patients that'll point towards you.
Good. So one point about kind of when you're talking the Uberization, and again, the specific example of coming out of the airport, there's a line of cabs there, and again, still choosing the Uber experience. And the big lesson to me right there was, again, kind of that the premium experience is worth kind of enabling, and again, paying even a premium to have a premium experience. And, one example locally is, again, kind of One Medical, with their pitch about the doctor's office reinvented, and really kind of trying to turn around what the experience is. So that's clearly an example of that. I haven't seen them take it to the wearable level and kind of that next stage, but clearly that's kind of an avenue. And it's really around, if I can give a user a premium experience, that's a differentiator in the market. So, and what do you see around that?
It absolutely is, both from a patients selecting, so Da Vinci's, those things are losing propositions. They're expensive, especially because they're not ours. But they're expensive, but they don't. Many times they don't get the throughput. But hospitals, even in some emerging market areas, will purchase them just because it's a flagship. We are an innovative site. We have a Da Vinci. And people will go to that site even if they don't need the Da Vinci procedure. So I think part of that use, and hospitals are investing in furniture. Because the difference in the Affordable Health Care Act is there is about, I think it's 3% of the, and margins are so tight for hospitals, 3% is huge. So 3% of the funds coming back to the hospital, be it whatever the payer is held back for the episode of care. And so hip and knee, there's a legislation out now that it may change it from 30 days to 90 days. So the experience of the patient while they're in the hospital, they fill out a checkbox. How did you feel? Was the nurse nice? Was the bed, just silly questions. Not really about the procedure itself, the experience. You fill that out, that defines how much you get paid. So I think they're doing it proactively as marketing to pull folks in, but they're also doing it now to get paid. So I think it's going to accelerate even more, obviously, in that front. I think I'm getting the gentle nudge. So if there are any last questions, or maybe we stop there. I appreciate the questions. I find that the most enjoyable part, and thank you for your time.